I'm going to talk today about TQRS supports and quality improvement using evidence from Miami-Dade County's Quality Counts initiative. My co-investigators on this work were Ioma Aruka and Kelly Maxwell. So this is just a little outline. What I'm going to do, I'm going to give a little background on Miami-Dade system, talk about our methods and results and conclusions. So Quality Counts is a voluntary 5-star system. And the main goal of the TQRIS was quality improvement. Some other systems have other goals, parent awareness, that sort of thing, but this was really focused on quality improvement. The components were similar to other states. Learning environment, evaluated using the environment rating scales, staff education, child ratios and group sizes, family engagement, program administration, and curriculum, although that was not initially included in the point calculation when we did the study. There were also supports provided to programs. Grants were given for materials and equipment for lower quality programs, and these had to be tied specifically to quality improvement, so they were limited in what they could buy. It had to be directly related to where they needed to improve. There are financial awards for achieving high quality, educational scholarships, using the TEACH model sort of thing, wage supplements, and then on-site technical assistance to improve quality. And I want to highlight that a little bit more because this relates to the professional development things we've been talking about at this meeting. So the on-site technical assistance providers, they had at least a bachelor's degree and some experience. They reported to use an adapted version of Pat Wesley and Virginia Bicey's consultation model. They received initial and ongoing training 2 days every other month. They each served an average of 13 programs, and they were employed by one of 3 agencies that were contracted to provide the TA through the QRIS. So the programs worked with their technical assistance providers to develop a quality improvement plan. And this plan identified the activities and supports needed to meet the program's short and long-term quality improvement goals. So programs were rated when they came into the system, and that was their baseline or time 1 rating. And then subsequent ratings were completed either annually if an update report prepared by the program reflected a star 3 or higher, or movement to a higher star 3 and above, or B, at least every 3 years, regardless of the results of the update report. So it was kind of weird the way they had this initially. They've gone now to more standardized rating schedules, but initially they only wanted to come back into a program if that program had some quality improvement. And then they have a web-based data system for gathering and scoring the program and staff information. And the data for this current study were drawn from this data system. So using the existing data from the WELS system, web-based early learning system, that's what WELS stands for, we explored associations among the TQRIS supports, quality, and quality improvement over time. So the supports included the scholarships for staff, on-site technical assistance, the number of hours, and then the financial incentives, so either those quality improvement grants or awards for achieving higher quality levels. And quality was measured as total points and star ratings in the TQRIS. And the research questions we addressed were, what were the associations between the TQRIS supports and quality levels? And then what supports were associated with quality improvement over time? So our study was based on data collected from January 2008 until March of 2012. There were 326 programs that included 258 centers and 68 family child care homes that had received a time 2 rating. And since we were interested in looking at quality improvement over time, we needed programs that had had at least 2 ratings. So that's what our sample was, those 326 programs with multiple observations. And we used separate mixed models for the centers and the family homes to look at whether the supports were associated with change in total points and star ratings. So again, our predictors were duration, the amount of time they were in the program, the number of hours of technical assistance, those program improvement awards, the monetary, the financial awards, and scholarships. And then we also included some covariates. We included accreditation, whether or not the programs were accredited by either NAEYC for centers or NAFCC for homes. We controlled for director's education level for centers, the percent of poor children in the neighborhoods where these programs were located using census data, program size, current enrollment, and then the percent of subsidized children served by the programs. So those are our covariates. Here's just some descriptives. So you can see that the centers, time one points were about 20, and this was out of a possible of 46 points. For the homes, their initial points were about 11.5, and that's out of a possible 32 points. So that converted into star ratings of about 2.4 for centers and 2.1 for homes. These programs were in quality counts from their time 1 rating till their time 2 rating for about 30 months. So that's about 2.5 years. That's a pretty good amount of time. The total hours of technical assistance they received, about 200 for centers and about 170 for homes. That averages to about 6 hours a month. Financial awards, centers received about $15,000 over that time period. Homes received about $7,000, so again, pretty good amount of money there. And then scholarships for staff, centers got about $8,600 and homes got about $1,400. So pretty good investment into the quality. So this is just showing the distribution of centers at time 1 and time 2. So the blue bars are time 1 and the red bars are time 2, and this is for centers only. And you can see that at time 1, the programs were concentrated at that 2 and 3 star level, with quite a few still at star 1. At time 2, they're concentrated at the 3 and 4 level. So they've definitely moved up in their quality from time 1 to time 2. So our results, we found that quality improved over time for both centers and homes. But remember, they weren't supposed to apply for a time 2 unless they thought they had improved. So it was sort of part of the design of the system that happened. For centers, our models explained 37% of the variance in time 2 ratings and 39% of the variance in time 2 points. We found main effects for duration, the amount of time they were in the QRIS, and for scholarships. So programs in the TQRS for longer and those receiving more scholarship money had higher time 2 points and star ratings. We found that initial quality was associated with scholarships and monetary awards, especially scholarships. We don't know why that is, but it could be that higher quality programs have more motivated teachers who are more interested in getting further education, or it could be that directors of high quality programs are more savvy at applying for these sorts of supports. So that's something to explore further. For family homes, we found that the models explained 68% of the variance in ratings and 74% of the variance in points. But we didn't find any main effects or interactions for the duration or the TQRS supports. We did find significant negative effects for the percent of subsidized children and neighborhood poverty. So homes serving more poor kids and those located in these high poverty neighborhoods tended to see decreases in their points and star ratings over time. So some conclusions and some policy implications. TQRS administrators should be vigilant in encouraging and supporting lower quality programs to access the supports that are available in these systems. Second, because family child care homes serving low-income families and those in poor neighborhoods tended to demonstrate a lesser degree of quality improvement, administrators might focus on these programs serving vulnerable children and in vulnerable communities. And that's the way Miami-Dade seems to be turning their attention at this point. Given that we didn't find any effects of supports or duration in the quality improvement system for homes, it might be that the current TQRI supports are more relevant for center-based programs than for home-based programs. So this is something to explore more. That duration was positively associated with change in quality for center-based programs, provides some preliminary evidence about the value of extended participation in TQRIS for child care programs, and information for funders that quality is not quickly improved. It takes time. So, there's some limitations of this. We were using existing data. So we had, for example, the number of hours of TA, but we didn't have any information about the content of that TA or the quality of the TA. So, just like we know that it's the quality of teacher-child interactions that are important and not just the number of hours that children are in care, it seems likely that it's the quality of the coaching, the coach-provider interactions, and not just the number of sessions or the amount of hours of TA provided. So there is much more to be done to better unpackage TQRIS supports beyond just these count variables that we had access to. So thanks.